that we catch you with HIV, the better for you because we can put you on treatment already. Seeing other people who are living a strong life having this kind of virus. This is just a virus. We're still human and we can fight life.
The World Health Organization records around 38 million people worldwide living with HIV and AIDS at the end of 2021, while DOH logs 1,347 cases in September 2022. In other words, HIV continues to remain a public health issue. Thus, every December, people across the globe unite to raise awareness on the disease, support those who are living with it, and honor those who have lost their lives to it. I am Crystal Alonso. Today, we will talk about HIV and AIDS here on Stuff You Should Know. HIV is a growing concern here in the Philippines. In fact, according to the Health Department, we have one of the fastest growing HIV epidemics in the world. Now, to tell us more about his knowledge and insight about this, let's welcome to the show Raymond Dabas, a grade 12 student. Welcome to the show. This is an all-important episode because we are trying to give more information about HIV and AIDS and how to prevent this. Now that we mentioned earlier that the Philippines is one of the fastest growing rates, unfortunately not just in Asia but in the world. Now let's talk about what kind of numbers are we talking about here in terms of Filipinos who are infected and why is it growing at such an alarming rate?
When we look at the numbers in the Philippines, now people who have HIV, they're actually a very small segment in the population. If we look at the reports from the DOH from 1984, when we started tracking HIV to today, it's about 105,000 people only compared to say 100 people in the Philippines. But in the high-risk groups, now we do have the fastest growing epidemic in the world right now. Now, we're at around 42 cases per day this year compared to all the rest of the world where it's already going down.
Okay, and to add to that, Mr. Raymond, based on the figures, what we're seeing here is they're getting younger and younger. Can you talk about this?
According to Dr. Carl Evan Simpson, HIV is now most commonly diagnosed from 15 to 34 in demographic, 20s to 30s group with the highest rates of HIV, so that demographic adolescents to young adults that were seeing new cases the most.
Okay, before we go any further, I'd like to ask you, these figures are alarming. It's going up, but our new cases here, can we safely say that these are consensual cases?
According to Lawrence Oleres, HIV advocate, mostly all the cases right now are not consensual. Most of the people who are living HIV, sometimes they don't disclose their status. At the same time, child abuse or rape victims might cause this high rate of HIV in the Philippines.
Okay, that's very important because we have to understand that there has to be some level of understanding also and what is causing this rise, and of course how the people feel those who are infected. We have that in mind, so which we'll be talking about later in the show. But Mr. Raymond, going back to some of the figures we just recently or are still hopefully at the tail end of a pandemic, has this affected the numbers of status of HIV cases in the Philippines?
Yes, it has. So COVID-19 has really impacted the way we take care of our creature for patients. But more importantly, services that to do with testing has been affected. But we're really talking about the early part of the pandemic, 2020-2021, where the rates of testing really dropped thankfully. As the pandemic has started to abide, we're seeing normalizing levels of testing, and with that, Now we're seeing more and more people getting diagnosed with HIV. So it's both, I guess, a good thing, a bad thing, because we're picking up these cases. But then it's an issue, chambray, that we're seeking more people that are infected.
Now, let's talk about HIV and AIDS. A lot of people hear these two words and think they are one and the same. They are related, but they're two different entities. Can you talk about them a little bit more?
Yeah, that's correct. So HIV is a virus similar to SARS-CoV-2, the virus of COVID. Human immunodeficiency virus is transmitted mostly through sexual contact, can be transmitted also to mother to child blood transmission. Once you get infected with HIV, then you start losing these very important cells called CD4 positive cells. So these are, I like to explain to patient as the soldiers in your body, where it protects you from all sorts of infection. So the virus attacks these CD4 positive cells. Eventually, they die off and you lose the numbers. At the same point, if you lose too much at a level of about 200 cells, then you start to develop all kinds of infections. That's what we call acquired immunodeficiency syndrome or AIDS. So it's a spectrum. When you get infected with HIV, at first you might not feel anything. But towards the more severe end of the spectrum, you get all sorts of opportunistic infections, so that's AIDS.
Okay, that's very good to know because some people can be infected with HIV their entire life but have not gone to the level of acquired immunodeficiency syndrome. Now, Mr. Raymond, would you say that one of the driving forces on why the growth rate of HIV in the country is very high is lack of knowledge of the disease in general?
Yes, I think that's really one of the biggest factor in order for us to pick up cases. They need to get tested, and there's this huge stigma about getting tested. No, we need to inform the public and especially the high risk groups about the need for testing the cases that we see on diagnosis. They're kind of mixed no more and more. We're seeing patients who get tested because they just wanted to get tested. I call that routine testing. We saw more patients before presenting with AIDS, the symptoms of immune deficiency. But I think we're progressing in such a way that those cases now are getting less.
Okay, that's very important. Also, we want to share with the viewers that it is important to get tested. And even with a positive HIV result, it is not the end of the world. It is not the deep sentence because with the proper diagnosis and the treatment, many people with HIV can go on to live near normal lives. When we return, we'll take a first-hand account on what it's like living with the condition. So stay tuned with us here on Stuff You Should Know.